name is Megan. I'm going to be your nurse today. Can you please state your name, date, and birth?
Chelsea, 313,
Okay, do you know where we are today?
at home,
And what year is it?
2020.
Okay, so patient is sitting upright, feet flat on the floor. She's well groomed, and her skin is appropriate for ethnicity. So I'm just going to ask you a few questions. Are you experiencing any shortness of breath?
No.
And what about a history of smoking?
No.
And do you have any chest pain right now?
No.
Okay, so patient is breathing effortlessly, normal pattern. As expected, that patient does not have a cough. Her thorax is symmetrical and it has 1:2 ratio of the anterior posterior. And I'm going to be checking for her trachea, make sure it's midline. It is midline, so now I'm going to be checking for chest expansion. So Chelsea, can you turn for me, please? Okay, and can you breathe in? And breathe out. There you go. All right. So now I'm going to be doing, chest expansion is normal. Now I'm going to be oscillating her breath down. And can you breathe in? Breathe in. Breathe in. All right, I'm going to go right under the bra line. Breathe in. And breathe in. Okay, now I'm going to curl from the sides, arm out. Oh. Breathe in.
Oh, is it camera?
What? Oh! Okay, breathe in. Breathe in. All right, other side. Breathe in. Breathe in. All right, now I'm going to listen to your chest.
Okay.
Breathe in. All right, and can you lift up your shirt? Breathe in. And breathe in. Okay, it sounds like my patient is clear throughout and no adventitious lung sounds. All right, now I'm going to be checking for jugular distinction. So if you can turn your neck to the right. Okay, and her jugular vein is visible. So if you can get up on this chair, I'm going to check for, I'm going to palpate your carotid artery. All right, I'm going to be doing this with one finger. Can you turn to the right? Okay. Turn to the left. Okay. Now I'm going to be listening to her carotid artery with the bell. Okay. Okay. Now I'm going to be listening to her heart sounds. Okay, you can lift up your shirt. Okay, now just listen to S1 and S2 and no other heart sounds were heard. Now I'm gonna be looking for the brachial artery. Okay, her skin is warm. No edema is present. Now I'm gonna be doing radial artery. Okay, now I'm gonna be looking for capillary refill on her nail beds. All right, capillaries are normal. Now I'm gonna be finding her femoral artery. So it's gonna be right in this area. Next, I'm gonna be doing her popliteal artery. So if you can face that way. Oh yeah, that's so fine. Oh wait, I need to do it on this side too.
You just know.
Okay. All right. Her popliteal artery is right here. Again, her skin is warm. No edema is present. I'm going to be checking for the posterior tibia artery, which is on the inner side of the ankle. Okay. And then now I'm going to be looking for the dorsalis pedis, which is if you follow the toe all the way up, right about here. Okay. And I'll be looking for capillary refill. Normal. And on the right foot, normal. Okay, now we're going to be talking about the case study. So patient complains of shortness of breath. Respiratory rate is 30 breaths per minute, which is too high. It's slightly labored, lung sound diminished in left lower lobe, but the right side is clear throughout. There is productive cough with green phlegm. O2 saturations is 95% room air, which is normal. The temperature is 102.1 by mouth, which is elevated. Heart rate is 98, and that was taken in the right radial. Blood pressure is 148/84, which is elevated, and that was taken on the right arm while they're lying down.
So her lab results came back and the white blood cell count was 14,000, which is too high, should be about 5 to 10,000. And her red blood cell count came back 5 million, which is within the normal range. It should be, so.
Her platelets came back as 300,000, which is normal. Platelets should be between 150,000 and 400,000. Her glucose was 75, which was normal. It should be between 70 to 100.
And her TSH came back 7.8, which is too high. It should be 0.4 to 4.0. And a chest x-ray ordered. Is this appropriate at this time? I think it would be to detect an infection or pneumothorax or fluid in her lungs because she had a productive cough and her lung sounds were diminished. So.
And is it appropriate to order a sputum cytology order? Yes, and that's to rule out cancer. And is it appropriate at this time to order a lung VQ scan? And yes, to identify any blood perfusion defects in the lungs.